Another one down. Is it looking good, Rob? You're always good. Different topics, though, right? So we're just kind of sit there, stand there. So you're planning to flip that up with different work. So only one day.
I know, I wanted to, I never get to see you.
So we'll all say that. These are on your way out, those of you who know, so you can have some Oh, wonderful. We're starting just on time. So thank you, everybody. We have a full house. It feels really warm in here. Obviously, we care a lot about well-being of people who are at this conference. So it's my pleasure. My name is Jillian Cranes. I work with HC Link. And it's my pleasure to introduce for our last workshop session here about the Canadian Index of Wellbeing, Gary Mackin, who's going to speak first. Gary works at the Association of Ontario Health Centres, and after him will be Louise Daw from the City of Guelph. And I myself was at the conference of the AOHC last spring. Were you both there? Yeah. There was so much talk about this, you know, the keynote or whatever that I missed, or the workshop that I missed. Anyways, I'm really glad to not be there. So they're going to each speak. We'll have some time for questions. And as you know, we're going to try and come up with some 3 key messages to share back at the conference at the end. So enjoy.
Well, thank you very much. And nice to see a good turnout here, and obviously some interest. And hopefully I'll help to add to that. A lot of the work that I've been involved with just recently through the association is, I feel like I'm a farmer sowing seeds, and a lot of it's hitting fertile ground, so certainly it's very encouraging. Because of the time, ideally what we had hoped was to get a sense from participants in terms of what drew people to want to come to this workshop, so we can kind of tailor our comments. But because of the numbers, a little concerned that by the time we'd start and end, that'd be the entire sort of workshop time allotted. But just very quickly, are there a few brave souls that would be willing to just share why it is that you're here, what kind of grabbed you about this?
Hi, I'm Nadine. I work at the Bramley Community Health Center, and it's the same thing. There's a lot of buzz going around the Canadian Index of Wellbeing, but I actually have no knowledge of it, and I haven't done a lot of research of it. I should.
So your fellow CHCer, great.
I am.
Yeah.
I'm Linda Bumstead. I'm with Grey Bruce Health Unit, and we did a community picture in 2010, and we used our stats that we have, but I've always wanted to move it to using this framework for it. So I'm really looking forward to this.
Certainly a lot more health units are showing interest.
I'm from a health unit as well, and we're particularly concerned about the recent National Household Survey findings for our area, which are not representative, are different standards than traditionally the long-form census. So we are concerned about our future local data and its quality. So I'm interested to hear about
More of the data.
yes, different types of indicators.
Certainly a lot of challenges there, but I certainly I'll try and speak to that. Yeah.
Curious to see if there are any applications for the Aboriginal population.
Okay. Yeah, certainly. I should point out that one of the organizations that we're funded by is the Ontario Children Foundation at the provincial level, and that is one of the key areas that they've identified. And a lot of work started to happen. Yes?
My interest is to find out how you've managed to apply the national data to your local community, and
if you are able to use it to factor in dollar the prevention dividend, so the actually gains of prevention, the economic gains, to be able to come back to your decision maker and say, hey, this is, and I think this is the major problem with GDP, that you measure a lot of the external costs, and that's what the Wellbeing Index is really.
Yeah, certainly the potential's there. I'm not sure that we're there yet.
Okay.
Yeah, but I'll be able to talk a little bit about the valuation. What I'd like to know is what my slide's showing.
It should be right. This computer should be like.
I can add lib.
You can get rolling on the intro.
Okay. What I'll do is I'll sort of wing it without it. Okay. So, first of all, just a little bit about the group that I'm involved with. We had one person identify that they're with Community Health Center, but I'm with the Association of Ontario Health Centers, and basically that's all community governed health organizations. So that would be community health centers, the Aboriginal health centers that you identified. There are CHCs that also work with Aboriginal populations. The community governed family health teams, as well as the nurse practitioner-led organizations. So certainly a lot of interest in this project. And the vision, and someone talked about a little bit about the buzz at the provincial conference. Charles Pascal, who was really one of the key driving forces behind the Canadian Index of Wellbeing, I think helped to really bring this to life. And the vision is the best possible health and well-being for everyone living in Ontario. Obviously a very tall order, but that's what visions are about. And in terms of the way I'm going to proceed, first I'm going to talk probably spend about 5-10 minutes talking about the Canadian Index of Wellbeing, which normally I spend about an hour and a half, 2 hours doing. So I'm going to really have to compress it. And I would suggest that if you're interested in the Canadian Index of Wellbeing, that you visit their website. They have a wonderful website. It's called CIW, www.ciw. But they have a ton of resource information there. But what I'm going to do is talk a little more about the spirit of it. And there's two metaphors or images that I use when I'm talking about the Canadian Index of Wellbeing, when I'm presenting to community groups. One is that of a compass. And sometimes what I do is I share the story about my one and only canoe trip with my wife, in which we went with another couple, and the other couple was supposed to bring a compass, but we were on a 6 Mile Lake, so how could you get lost on 6 Mile Lake? But it was cloudy, and we managed to do it. We were 3 hours way behind schedule, so we didn't get to our campsite. Slept on a hill. There's a stick in my wife's back. We tried to catch up for her time the next day. Shot rapids that we shouldn't have shot. Jumped out of the canoe. My wife got sunstroke. And suffice it to say, it was a holiday from hell because we didn't have a compass. And I think a lot of it, a similar case could be made for our society that we really have a faulty compass. It's not that we don't have a compass. And our true north, the true north that we use in our culture is the GDP, the gross domestic product. In other words, the total number of sales and of products and services. And as Robert Kennedy said many, many years ago, the problem with the GDP is it measures a lot of things that are not in keeping with healthy communities. Tobacco sales, GDP goes up. Wars, the GDP goes up. Oil spills, the GDP goes up. And conversely, it doesn't measure a lot of things that are really important. Volunteering in communities, taking care of our children, and the things that matter. So the Canadian Index of Wellbeing really started off as a what-if question that Charles Pascal and the board at the Atkinson Foundation talked about, and that is, what if we had something other than the GDP by which our society could have as an alternate true norm. And it was following that conversation, a call was made to the Honorable Roy Romano, who just was winding up as the chair of the Health Commission report under Jean Chrétien's government. And Roy Romano, because of his political background, just thought this was a wonderful opportunity for Canada, and proceeded to serve as the chairperson, the advisory chairperson, to which he still is. And the Canadian Index of Wellbeing just is located at the University of Waterloo, so that's its home base right now. There is one other metaphor image that I use, and that's of a lens. We all view our life, our experiences through the filter of a lens, and that's true in our personal lives, it's true in our communities. And what the Canadian Index of Wellbeing, I believe, does is it provides a holistic lens, way of viewing community. And for those of you that are somewhat familiar with community health and health promotion, which I would suspect most of you are in this audience, I think what you'll note is a lot of overlap between this and what would be referred to as the determinants of health, although the language is different, and language is very, very important, certainly if you're working with governments and political organizations. The difference between this and determinants of health is these started as grassroots conversations. In other words, it didn't begin as an academic exercise. And the way it began was conversations across Canada in which Canadians were asked what constitutes a good quality of life, what needs to be in a community in order for it to be healthy. And invariably what you see are the same things cluster up. And then once those themes were identified, that is when the experts were brought in to look at the indicators and what have you. And just out of curiosity, what domain do you think was the most popular one in terms of the public? Any guesses? Yep, you got it. And that's interesting because when Roy Romano approached the CHCs initially, there were going to be 7 domains, and that was the 8th domain. But the reason that was included was because of the involvement. It started as a grassroots initiative. But by far, I mean, the media coverage of this was phenomenal. It was an issue that everybody could relate to. So that's, I think, why a lot of this really resonates. Now, my involvement is in terms of really trying to encourage the community health centers and the communities in which they're involved to apply this strategic level. And so one of the things that I learned through my time in Barrie and Simcoe County and doing this was I really believe it's important that this work be integrated into the life of the overall organization. In other words, it's not enough to just have a health promoter who's out there running around. It's important that this be part of the DNA of the organizations. And so the strategic applications that we're using starts right at what we refer to as the intake process. So if you can kind of imagine going to your doctor's office through the intake and assuming that they even do physical that goes much beyond your vital signs, you would be asked questions about your level of involvement in the community. And some of those, basically some questions from each of those domains. And what that in turn does is it allows the sector to make more informed decisions around the kind of programs they offer. But part of the reason I wanted to flag that is because one of the themes for this conference is linkages. And if you do this in a holistic intake, what it allows you to do is make those linkages right off the bat. So for example, if you look at the community vitality domain, there's questions around, are you a member of groups? Do you volunteer? And a lot of people are socially isolated that we deal with. So right away, when you're getting that information, the logical step is to then make referrals to people in groups and things like that. So it's a wonderful linkage tool. The other area that community health centers, and again, I'm working with about 8 to 12 CHCs right now that are really in what I would refer to as a leadership role at this, and there's another 30 CHCs that have expressed interest. But some of the CHCs are using it as a tool to engage their existing members and clients. And I think this is really important in terms of what I've referred to as the power of the people. And that's really what community development is. It's about asking the people who are using your services or what have you, what is it that you want to see, as opposed to helicopter dropping these programs on them. And I think that we have a lot of work to do there. A lot of what I see passing as community development here is what I would refer to as a consensus of a leads model. And what I mean by that is you gather the who's who and they pontificate about life's many mysteries, but at the end of the day, not a lot changes. Whereas with this, I think what you're wanting to do is really tap into everyday people. And I've seen time and time again how that can really impact. And again, that's one way that the tools can be used. And it was through that approach that I became involved with this one. I've talked about the responsive programming. Most definitely, it's a wonderful tool for community engagement. And Louise is going to be talking about that shortly, so I don't want to spend a whole lot of time there, other than to say that there are other CHCs, Kingston, in that whole area most recently. And someone was, I can't remember who was asking about the data, I think you were. And increasingly, what I'm seeing is it's a bit of a nightmare to try and find comparable statistics through secondary sources. So increasingly, what I see happening is where it's more of a primary care research in terms of actually going straight to people with the surveys and intents. And there's things that we're learning about what works and doesn't work there, and I can speak to that a little later. But more and more I see that's sort of the direction that we're going. I think that there's an opportunity for high impact communications. And I think the wonderful thing about this is, and what I'd like to see, and we're not quite there yet, is where the communications aren't just about how we're doing as communities, but also highlighting some of the great work that is happening specific to each of those domains. And maybe even posing a few questions about things that the community might be wondering about in terms of future work. And again, I think Louise will have some really wonderful stuff to share, because I think Guelph's been a real leader in the area of communications. It's been a wonderful tool for community planning. Increasingly, I'm working with community groups of all stripes, and everything from social planning councils to anti-poverty groups to you name it. And what I'm finding is that the community, that the CIFW, it really resonates for groups. It certainly resonates for the municipalities. The language sometimes works better than when using language like social determinants of health. And also what I've found through my experience is just most of the research that we've done has been done through partnerships with universities and colleges. So it's not like everyone's going, well, we don't have enough staff to do that. Well, think outside the box, and I think that there are a lot of resources that you can tap into that would help you get the work done. Okay. We talked about research and evaluation in terms of starting to look at impact. And one of the, and in fact, the whole area of interest for the Ontario Trillium folks is they're interested in the area of collective impact. And increasingly, I think what you'll see with Trillium is that they are going to be adopting the Community Index of Wellbeing as a way to assess impact. I think that's hugely significant because if the funders start to use it, then that will have most definitely an impact in terms of what will be happening at the community level. And within the community health sector, what we are doing is we have these agreements with the government. They're called MSOT agreements. And right now, if you were to look at our MSOT agreements, you know, the sum total of how we're sort of assessed is the number of pap smears we do, or all this silly nonsense. So what we're thinking of doing is just taking a few of the indicators from the Community Index of Wellbeing and integrating those into our MSOT agreement. And one of them will probably be community belonging because there's a very strong correlation between community belonging and lower utilization rates of formal health care and human service providers. So I think that there's certainly, when you're talking about impact and evaluation, but it goes right back to the intake, it goes back to the member service engagement, but what it would give you is a benchmark at which point you could follow up to do your evaluation. Sort of talking about.
Yeah. Time for a quick question.
Yeah, sure.
Yeah. So you talked about you were doing work with anti-poverty groups around this, and you also mentioned that this tool can be more effective than the social determinants of health. And one thing about the social determinants of health is that it does bring out really well issues of inequality. So can you maybe speak a little bit about how you can use this tool around social justice and inequality issues?
Right there, that's social inequality.
Yeah,
But I think in terms of, like the reality is, and I think that's the whole thrust of the Community Index of Wellbeing, is there's the recognition that there's been this incredible economic growth. And that when you look at what's happened with it, the question is, well, who's benefited from all of this economic growth? And if you were to look at a lot of the papers and whatnot, in fact, there was that big grand inaugural sort of opening where Lord Romano really talked about the people that are left behind. And in particular, he spoke very passionately about children and youth because the findings there were just so significant. I think in terms of, if you were to look at the living standards domain, which is probably the one that would most closely link with the anti-poverty groups, I think one of the things that I really like about it is the historical trends it offers. So you're able to actually go back 30, 40 years and monitor not just what's happened with living standards, but you can form correlations between the recovery rates and the social safety nets. There's a lot I could get into about that. But when I'm talking to a municipality, and you know where I am, it's a sea of blue. But if I was to use social determinants to help that language, I'd be taking in a millisecond. When I go in and talk about community health and well-being, they have no issue with it. I say exactly the same thing. One language, they're fine with another. they really exist. So,
Do you want to do more questions, or do you want to finish up?
maybe one quick question.
Sure.
Gary, I just wanted you to check, so at a community level, the information would have to be collected. We only have it at a Canadian level right now, right? We don't, can it go down?
It will be at a provincial level. The Ontario Children Foundation has funded the CIW to prepare an Ontario report. Best guess is that'll come out in April. The idea, also they're going to be, but at the local level, and the way we did it was through piggyback reports, because when we started, it wasn't all built. Like they went out domain by domain. So every time they went out with a domain, we piggybacked. We went with secondary data sources, but typically you only usually can find 3 or 4 comparables to the 8 that are there. So it's not bad. I mean, you get the discussion. So you can blend it, but I think increasingly, because of what's happened with Stats Canada, I would recommend certainly, doing some of the farming work.
Thank you.
And it's,
Okay. Well, Gary.
Hopefully I can get mine up here now. Oh! No, I pushed escape and
I didn't like it.
I didn't like it much. It's frustrating. It is frustrating.
I'm going to try escape again.
Yeah.
What would you rather go?
There we go. Yep.
Okay. Thank you so much for inviting me to participate and come and talk a little bit about what the City of Guelph has done utilizing the Canadian Index of Wellbeing. And it's great to see some people here from Guelph, so that's good. Yay, Guelph! So I just wanted to pause for a minute and ask people who in the room, just by show of hands, are very familiar with all the domains. Okay. So we in Guelph decided to use the Canadian Index of Wellbeing. We determined that through conversations that we had with other indexes, that the Canadian Index of Wellbeing was probably going to be the one that best suited Guelph, and I'll talk a little bit as to why we decided to even take on this task. So really what Wellbeing does, and these are actually pictures of Guelphites, so they're legit. Well, Wellbeing starts with the essentials of food. These are pictures that were taken in Guelph, and shelter and healthcare. And it also includes how we spend our time, how we get around, how we care for each other, how we earn a living, and how we actually look after our planet. And I have to apologize for flipping through all these. I've got so many different presentations, I didn't know which one I was using today. It's also about feeling safe in our community and how well you feel connected to places and the people around you. And it's also about the quality of our neighborhoods, our parks, our spaces, where we communicate and maybe where we don't communicate as well. It's also about being able to express yourself and participate in activities that we love. And I love this picture because my office is right here. And I get to look out, and it brings joy to me, believe it or not, in my day, because I can see people really enjoying that water feature. I see little kids out there screaming, and there's nothing that brings more happiness to me than hearing kids screaming when they're not my own. And this also turns into an ice skating rink in the winter, so it's really lovely to see people come out, being active, enjoying that whole civic sense of well-being and community connectivity. So our vision statement at present is Guelph is an engaged community that creates healthy and resilient people, places, and spaces. This vision statement was developed through numerous inputs from the community, which I'll talk a little bit more about. But it was also at a stage where we were just developing what the Community Index of Wellbeing was going to be for our community. And I think that our vision may change, not change in that we're not going to still think about this, but our vision is really becoming the best quality of life for all people in Guelph. So we're seeing a little bit of a transition in that. We also, you might notice that our little icons for each of the domains are slightly different to the ones that Gary put up. We wanted to capture them by just to sort of set out a little bit of a difference from the Canadian Index of Wellbeing. So we did have a local artist that actually created these icons for us. And again, we utilized all of the 8 domains, and everybody's quite familiar. I'm hoping that it does fit pretty closely, I think, to the social determinants of health. And I think just to reflect on a comment that Gary had made with regard to social determinants of health versus the Wellbeing Index, I can concur that using that language has been a little bit more of a door opener when I'm out in the community. So just a little point of reference to talk about that. So why we started even thinking about why would we even have a well-being index or a survey in our community. So there were really basically 3 pressure points as to why the city wanted to take this project on. One was that we realized that the community benefit sector, i.e. nonprofits, voluntary organizations, are in crisis. We all know that we're all competing for similar funding, and in many cases, you know, reducing staff, et cetera. But just funding is not necessarily what it used to be. We also noted that we lack an integrated and coordinated service planning, service delivery, and we're all working in silos. And even though the domains look like they're silos, there's an awful lot of overlap in those domains. So we are also seeing that there's an awful lot of duplication of work, and also there are many gaps in our communities with sometimes poor outcomes and missed opportunities. There was also a lack of comprehensive strategy to link the expenditure or the resources in public and civic resources to connect community-driven goals. So these were the 3 big pressure points as to why we determined that we need to take something on. So I'll talk a little bit about the community engagement that we did, because this is kind of where I came into the scene. So a lot of community engagement was just in process when I became the project manager. And it's me, myself, and I, basically, as a staff person, so it's quite complicated and many twists and turns in this project. So when I came on board, there was an awful lot of community engagement going on. So one of the things that we did do was we had comment cards placed strategically across the city in doctors' offices, in libraries, at City Hall, in homes, in community organizations, anywhere where there were people, there were comment card boxes. People had an opportunity to write what they saw as their particular well-being, what was well-being to them, what did they love about Guelph, what didn't they love so much. And we gathered close to 1,000 inputs of that just through comment cards. Those hard to reach places, we actually sent out someone that actually went into homeless shelters, into shelters, down alleyways to actually get input from vulnerable groups, into senior centers. So we had a lot of input that way. We also did something that was called Photo Voice, and that was the University of Guelph students went out and they took photos of what well-being was to people through the lens of a camera. And that really presented some really interesting photos, and I don't have any here to show, but you could see them on our website. So for example, there would be a beautiful park, but there was tons of litter, graffiti, torn down playground equipment, those kind of things. So there were pictures that you couldn't really necessarily put in or articulate into words. Or access to a park, for example, meant a very large staircase to get into the park. So there were pictures that were taken through Photo Voice. The mayor also held a telephone town hall where individuals or citizens could contact the mayor directly through a telephone town hall, and they could ask or give their opinion to the mayor that way. And then the big thing that we did was we used the Canadian Index of Wellbeing Household Survey, where we sent out over 9,000 surveys that were adapted specifically for the city of Guelph, using all of those 8 domains with specific questions to what Guelphites would find for their well-being. So we had a response rate of over 15%, which we are told by the University of Waterloo that that's a very good response rate. And it was also interesting because it was also done at just that peak time of June, July. So we are very pleased with the results that we identified. So we were defining what we would value in the city of Guelph, and what was it that we could do with some of the findings. That's where the fun begins. So what we were looking for in terms of our outcomes was we wanted to develop new relationships within the community, to have more authentic engagement. We wanted to be able to deliver efficient and more effective services. And we wanted an advocacy tool for other levels of government so we could lobby for policy changes, for example. And we also wanted to develop collaborative partnerships, creating innovative responses. And we certainly have seen some of those coming forward that I can tell you about. Now this project timeline, trust me, I couldn't fit everything in, so I just kind of put the highlights. So this is kind of where I entered into the scene right here, but all this other work had been done previously. So my task was to handle every single one of those comment cards and just define what people were talking about in terms of what they saw as their well-being. So we had over 3,000 inputs, and then we developed what we called the engagement report. All of these documents are on our website, which I can tell you about as well, so if you want to look into that. And also, we also have a developmental evaluation going on at the same time. So is everyone familiar with a developmental evaluation? Yes? Okay. No. Okay, so I'll tell you very Cole's Notes version. It's an evaluation to evaluate the project as we go. So we're tweaking things as we go, depending on what our consultants say. Maybe you should be looking at this because we're not getting good responses in this particular area. So it's an evaluation process that helps us alter the way that we are working this project. I should also say at this point that we are the first Canadian city to have done a household survey for a city. So we're really a test project, and all eyes are on us, or me. I hope it's not me. But so it's really been interesting because we have had to make many changes in the way that we're working. So from that input, we decided, well, we've got all this data, what are we going to do with this? So we took our little thinking caps and we thought, well, let's hear more from the community. They've told us all of this information. How are we going to actually make this into some kind of a better well-being? How are we actually going to improve that quality of life? So this is where we developed what we were calling design teams, and there were 8 design teams, 1 for each domain. And interestingly enough, even though time use is probably one of the most impactful domains, it wasn't the one that was the most well attended from the community, partially because not only did it intersect all of, maybe they didn't have time. Somebody thought of that joke. It wasn't me. Anyway, yeah, we've had lots of those jokes. Anyway, so we did have a lot of interest in the area of community vitality, healthy populations, living standards, and leisure and culture. So those were kind of the 4 top line ones. And from there, we've determined what goals could we use in our community to help develop some of those policies that can make change to make our lives better. Sounds simple enough, but it's very complicated. So through the work of the design teams, we've identified some goals. And in between all of this stuff, way back here, we have the mayor is our chair of our leadership group. So it's being spearheaded by the city of Guelph. The mayor presently is the chair. And we selected, or a group of individuals from the city of Guelph have selected 16 various people who are leaders, champions, networkers, the go-getters in our community that represent the private sector, the public sector, NGOs, and some community citizens as well. So we have our chief of police, who's very heavily involved, Chief Brian Larkin. We have representatives from public health, representatives from the Community Health Center, Family Services, United Way, the Cooperators, who is a big company in the city of Guelph. It's an insurance company, and a host of other people. So we have fairly broad representation on our leadership group, and their role is to help us move and shake those trees that need to have policies developed within, not only within their organizations, but that's part of our larger communication plan, is they're out there talking about well-being, they're out connecting with people and moving things along. So we're somewhere way down here, and I'll get to how things are changing. So just a little bit, very top line. This is just one slide of many that was a result of the household survey put together by the University of Waterloo. And as you can see, most people find that overall, Guelph is doing pretty well. So we found that neighborhoods are very important to people, but look what's not so good is the honesty, transparency, and local. So a little bit of work to do there.
I have a question. Does that scale go only up to 7?
Yes. Yes, it does. So just really interesting information that we're using. And I should also point out that we were also able to, when people asked about the GDP and how it shows the social determinants, we can actually break our data down by income levels and ward levels. So just so people are aware of that as well. So as I indicated, overall well-being in citizens of or residents of Guelph is quite good compared to other parts of Canada, and that's more national. Residents are most similar in their impressions of aspects related to the environment, democratic engagement, education, and time use. And they're more dissimilar in the aspects of living standards, healthy populations, community vitality, leisure, and culture. And there are also dissimilarities in terms of equity of equality of access. So we have obviously identified gaps between lower income and upper income households, and also by ward. So some of the reflections that I can tell you about in terms of the benefits, so access to the expertise of the folks at the Canadian Index of Wellbeing has been invaluable to us, partially maybe because we're the first Canadian city, so maybe they've over-delivered for us, but they've been a wonderful resource to me and continue to be. They also have the capacity to do these kind of surveys for communities, and they all obviously allow us to have that sense of credibility. And it's also helped us with the opportunity to contribute to work on a national and international. The City of Guelph just recently won an award in the City of Chicago for the American Community Impact Awards. So we had submitted award nomination through one of our leadership group team people. We actually won, so that was kind of impressive. And we do get calls from all over the place, so it's quite interesting. And then we have also indicators that are going to become a basis for us for some collective impact work. So we've identified some measurements, so that's been really key. And it also is going to help us give the ability over time to make some of those comparisons. So the intention is we will repeat the Canadian Household Survey again within the next 3 years. And we're still having to, iron out some of the kinks on that. And it also helps reinforce well-being into shifting our whole community to start thinking about well-being overall. So for example, the cooperators can start looking from their lens of a business on how can they implement some well-being within the structure of their own business. So it's a very ambitious project. Without trying to be hierarchical, I tried to outline what this bigger picture looks like. So the leadership group, also they're the connectors, the champions, they're not really the boss of me. I guess the boss of me is the City of Guelph, because they sign off my paycheck, but It's more of a consensus building. Everybody contributes in some way. We do have a marketer on our leadership group, and he's helping me build a communication plan, for example. We rotate meetings, so food is provided by the various organizations, so it really is a collective structure. We have all up at the top, those are all the index of well-being domains, just represented by color. And the community well-being indicators are those little hooks as to where does a community fit. So where would I fit if I work at a life insurance company or whatever. So how can I see myself in this whole bigger picture of aligning ourselves with this whole vision of well-being? So there are some existing strategies that are already in existence within the community that we're trying to kind of leverage and determine how can we alter some of these things that are already going on and making it a bigger picture. So for example, the health unit bridges out of poverty, obviously looks at the lens of living standards and how we can hook into that whole program and initiative. Net Zero City, which as of yesterday has been renamed Emerge Guelph, is a net zero environmental group that received Trillium funding to create the city of Guelph as a net zero city. So we're trying to hook into that from the environmental domain. The Health Links is another great hook into the community well-being initiative. So we're looking at ways of working towards, are people familiar with Health Links? Yes, okay. So how Health Links will work is they are looking at that top level, the 5% of individuals that are utilizing health services in Guelph. So they actually are going to go out with a healthy passport and determine why are these people using the health system as they are, and finding out that, you know what, it's because they don't know their neighbor, they don't know what to do, maybe they're isolated, maybe they're not able to get out or whatever. So we're trying to determine through Health Links how they can hook into that well-being. So there are many things that are already happening within the city overall, and these are our enabling platforms. So by enabling, that means we're bringing resources, we're bringing our strength, we're bringing our money, our bodies, our people, our initiatives to hook into this whole overarching alignment to bring outcomes. It's the best way I could do. I had circles and I don't know, I was getting frustrated by the program at that point, so I thought, screw it, lines it up. So collective impact is our approach. This is the approach we're taking, but we're using the index as our framework. I'm sure everybody's heard of collective impact. The approach is just being adopted by the leadership group, where we have a common agenda, a shared vision, shared measurements. Those are the indicators that we've already collected through our community engagement. A way of communicating, so we are building our communication plan, and the fifth one is the backbone organization. So who is the one that's going to lead the charge? Because it's all great to talk about this, but to go out and actually implement this, you need to have an organization, the doers in the community, which happens to be me, myself, and I at present, it feels like. But trying to see who can take that on. Presently, it's the city of Guelph. It might be the cooperators, it might be police services, it might be family services. We're not sure. That's where we're at now. We do have funding up until January 2015, and at that point, we're going to see where can we leverage some of our resources to start implementing some of these collective impact approaches and to keep things going. This is just a quick pictorial of the function that I sit in within the city of Guelph is Community and Social Services. And these are just pictures of the environment. So what do we have in the capacity of social services that we're hooking into the Canadian Index of Wellbeing? So we just took an afternoon in the summer and determined what we already are working on presently to help inform what is already going on and identifying some gaps. So you can see social services, although we're interested in the environment, it's not really top line. We're a little bit more heavily into the living standards as an example. Transportation might be a little bit more interested in the environment. So you can kind of see where we're going. So we're doing a lot of mapping with community organizations. We've also used the youth strategy as an example where we can start looking at where are those icons, what are all those things that the youth strategy is looking at that can also plan and hook into that community well-being index. We're also using this as our policy framework. That just looks so boring to me, but I'm going to move on. So reflections of using Canadian index, I think just for consideration that we need to talk about, because even though it may sound all rosy, it's a lot of really hard work. We've taken many twists and turns, some things we haven't done so well, some things we've been brilliant at. So the indicator availability at the local level, it's not always there. It's just simple. We don't have the resources at this point in time to be able to measure some of the things that people have identified as being important. So that's an area we're going to have to look at. We are not paying enough attention, obviously, to the economy and GDP. That was brought up by some people in the business community saying, well, we have to talk about the economy because that's part of it. So that is a consideration. We're not sure really what to do with the time use domain, simply because there hasn't been an awful lot of it, and yet it impacts us so much. Just as a side note, really interesting, top line, people were really concerned about moving around the city, whether it was by bus, by bike, by car. And really, that's about time, because many people have 2, 3 jobs, and they can't get that bus because that bus won't take them to there, and if they don't, they're running for that one, and it's just becomes about timings. But people don't really identify with that one yet. We have multiple levels of indicators. We have StatsCan reports. We have community level reports from public health. We've got various reports, and we're trying to kind of retrofit those. That's a challenge as well. And we're trying at this juncture to determine what actions can we take as a community to move that needle to show that we have made an improvement. And as you well know, working in public health and being health promoters overall, it's really challenging, hard, tough slugging, because things don't happen overnight. So we're very familiar with that. So there is our website. It has all the documents posted up there. If you look under reports and documents, that's where you're going to get to the meaty stuff. If you're looking for something in particular, you can contact me. I don't think I was smart, or was I? Oh, I was. There's my email, my email address, if you want to get in touch with me. And I just think that that's pretty much it. So questions, I guess. Hi. Lots of familiar faces.
Budget. I'm more interested in the implementation of the survey and stuff. Just from a healthy community's perspective, and the money that we get and that. What could we project?
Well, okay, so you have to consider a number of things. So one is the actual development of the survey. I believe that cost us around $35,000 to $50,000. Don't quote me on the exact, but that's the range that it was to develop that survey. The great thing about that, though, is, just put a plug in, is there are so many different ways that you can manipulate that data to get out what you need. So I said to Brian, or Dr. Smale, I said, you know what, we need to get wards. I want to see what this looks like by ward. I want to see this by income. I want to see this by what's most important to folks. There's some great manipulation in the way of getting that data. So there's that. Then there's obviously my salary, and that's not a lot, okay? I just want to say that right here. Everybody says, oh, you're doing the work of 2, 3 people. I'm going, really? Not my paycheck. But you have to factor in, somebody has to push send on those emails to get meetings going. Somebody's got to organize the events, which I do a lot of. Somebody has to gather, rally the troops. Somebody has to talk to the media. I do Facebook, I do Twitter, I do all of that kind of stuff as well, in addition to the communication plan, getting the leadership group pumped. So there's the salary component. So that could come out of what we are calling the backbone organization. We're looking presently to second somebody, hopefully from one of the leadership groups, because I need help in the area of communications. I can't keep up with the requests we get. So it's really a shared approach. So even though, you know, everybody wants to know the budget, I think that over the course, and this has been going from 2011 to, well, up until 2015, it's about $700,000 that's being committed.
Just the survey part, because
oh no,
I
that's not the survey.
am you going to be, I just
Yeah,
want
yeah.
to know what the survey part.
35 to 50.
That's for the development, implementation, and the fact that.
That's for the development of the survey, them pushing it out, them mailing it to some people who needed it mailed. It's gathering the data, putting that all together. They have researchers from the University of Waterloo. So I don't know the exact, like to the penny,
No,
but that's a ballpark range. And keeping in mind, we might have gotten a little discount, price cut, because we were the first. I don't know. Maybe they've upped it when they thought, holy shit, no, Louise is going to call me for this.
So Robin, do you have something from someone?
It's actually somebody
online?
online wants to know if this tool can be used for assessing the school system and health promoting schools. That's probably more of a question for Gary, but I guess for both of you.
Well, I think it could be, because it would certainly fit within the lens of many of the domains. So it could be under healthy populations, or leisure and culture, for example, or under the education realm. The tricky thing with education, at least for the work that we've been doing at the City of Guelph, is that education in relation to the national survey in the Canadian index is more formal education. Whereas municipal governments really don't have a lot to do with that component other than school boards. But we were looking at informal education opportunities. But in terms of schools, there are certainly ways that you can adapt some of the data to take care of finding out that data. Yes.
Oh, sorry.
Yeah, do I talk in like who's on that?
Just talk.
Okay.
Yeah,
the Resilience Collaborative, and that was sort of the umbrella group that we created. The municipalities are a partner in it, but it's not led by the municipalities. The school board's been a very key partner in all that. And there's no question that under the education domain, that there's several indicators there that can be used. But you have to be careful, because there's a lot of games that get played to get statistics up, which I'm not going to get into the politics of evaluation. Anyways, I'll leave it at that.
Thank you, Gary. Very helpful.
Yeah, I just wanted to ask a couple things about this survey. Is it self-select? Is it online, and is it self-selected, or is it a random survey? So is it representative of the population at large?
Yes, it is.
Okay.
It is. So it was distributed equally across the city.
Okay.
And when we did do the breakdown by wards, it was very well represented in terms of age range, in terms, like all the demographics, it was very evenly distributed.
And how did you get, there was some qualitative data you collected on cards and that. How did you
Correct.
integrate that into the survey results, or was that an aside?
It was a part of the community engagement process that helped inform us as a city on how we could move the dial on well-being. It was part of a bigger piece of the puzzle. So there was kind of the household survey, which provided us with about half of our responses.
Okay.
And then the rest of them were done, like I said, people were out writing comment cards, and the mayor did a town hall, et cetera, et cetera. But interestingly enough, they were very reflective of the household survey, which I was very thankful for.
Yes.
Because I thought, oh my God, that's going to be another story. But no, it was very,
comparable.
Absolutely, which was very interesting. So just as a side note, I think that also brings some really good credibility to using the Canadian index, because it was very transferable.
Yeah, there's different municipalities or groups use different ways. Guelph, they did it through their tax rolls, and Kingston, they did it through the postal office. And our community, and we've done a variety of approaches, but often what we did is just teamed up with university kids, and they'd go to shopping malls.
Right.
And we didn't always do all domains at the same time, because that'd be a lot of people's time, so you're just honing out the domain that you're interested in.
Hi.
Hi, great work. You really broadened it to move it out of just, not just, but beyond health and social services. And you mentioned a few times about the mayor being a champion.
Yes.
So can you speak a bit about, was it a hard job convincing thought leaders or influencers outside of health and social services that well-being affects all broad sectors of a community, like in an interactive loop? Because to have others involved, that it affects the economy of a city or whatever, or the workers that won't choose to live there, takes the discussion to a different level of relevance about why people should pay attention to it.
It's a great question, and it's a good one, because the mayor has been very pivotal in this whole project. She's, you know, really a great advocate of this. And there's not, and like I said, have been bumps, and there are people, oh, my taxes are being used for this. So in an effort to address some of those issues, the mayor has done a number of speaking engagements, and one most recently with the Rotary group at this, in Guelph. And so I'll just put a little shout out for myself here. I thought this would be a great opportunity to video this, because these are going to be the people, the Rotarians, that probably are going to have some business type questions. The Chamber of Commerce was there. So she really altered her conversation to be more about how is this actually causing us to be more efficient in terms of our taxes and better use of our tax dollars. I'll give you an example, and you can see her video will be posted on our website as well. So as an example, there is an individual in Guelph that had called the police department 500 times in a year. 500 times in a year. So just think about the impact of that. So police would arrive, maybe ambulance might, maybe firemen, maybe they were all there. So who's paying for that? Ultimately, taxpayers are. But that individual kept calling 500 times, and it wasn't because she needed help. It wasn't a 911 call. She just didn't know who else to call because she was older, she was isolated, her children lived out in the East Coast, and she didn't have any connection to her community. So if we had better connections to her community, maybe she wouldn't have been so quick to call 911. Because people, that's what they do when they're feeling not knowing what to do. So as an example, and there are many other stories that we have gathered in an effort to show how this can be really more cost efficient, and we're not really ultimately, when we're addressing those 911 calls 500 times, we obviously didn't solve her problem, right? So we need to look at how can we better utilize our monies and our limited monies that we're going to have, because everybody knows that we're in crisis in that component. How can we address that? So something like health links, maybe this woman just needed to be more connected, or maybe she needed to know that there was a community health center that could have answered her question. She didn't need to call 911. So there are many examples of that I think when people start saying, oh, you know, this is just another flighty, feel-good thing, oh, is this the happiness index, oh, are we going to smile more? It's not necessarily about that. When we bring it down to, you know what, it's going to help us save our money, and not only that, we're actually going to help our residents. I think people really thought, oh yeah, okay, I get it. And I think that Rotary speech would be a really great thing to view, and I'm not sure when we're posting it because it's just in the process of being edited, but it does address the sort of the quote unquote naysayers. And like, I'm not going to paint a rosy picture. We do have people saying, what are you doing? What is this about? So we have to address that. Any other questions? Yep.
How about moving the needle? What's any areas or any specific programs that you're envisioning already, or is it too early to start?
We're in that stage presently where the leadership group is, so I'm very deep in data right now. We're trying to determine which domains, because there are 8, which domains are we going to really focus our energies on? what are those indicators that we're going to be able to identify in 5 years from now that we can work on? What already exists in our community? What gaps are there? We're in that process presently. So by the end of November, I think I might have a little more clear direction where I will be focusing more of my energy. So we've done all the collecting of the stuff, kind of swirling it around, and is it 8 domains? Oh my God, maybe not, there's too many. So we're really honing in on a couple that we can really sink our teeth into, get the community involved, because there are obviously things that people can do at the individual level, at the system level, at the city, all levels. And we're just in that process now. So being realistic, it's really hard to know making changes, as we all know in health promotion. Let's, talk about obesity. So, I mean, those are the things that I can't predict. I'd be a very rich woman if I knew the answer to that, but I would say within probably 5 years, we're hoping to see some change. And you know what? The change would be the other way too. Who knows? Any other questions?
To our kind of wrap up with the key messages. Does that seem, if nobody has any pressing questions? Okay, so we have about 5 minutes to reflect as a group on, and you guys to be a part of this too, on what are you taking away from this workshop, and what are some key messages or key insights? I'm going to flip chart them over there, if that's okay. Maybe you want to talk as a group for a few minutes at your table, and then we'll ask you to share them back. Would that work? Why don't we take 5 minutes as a group? What are some key insights? Come up with 1 or 2 from your table, and then we'll gather them. Okay?
It's hard to
I just have to
and that's why I mean,
But they did that by doing it.
But they only did it, I guess, they only did it for
exactly. So,
but, like,